Really excited about this session, which is Nutrition for Wellness. The founder and CEO of the Nourish Center, Shanon Whittingham, is here with us today. As in addition to being the founder and CEO of the Nourish Center, Shanon's also a leading national nutrition and healthcare organization who's often featured in syndicated publications such as Women's Health, Prevention, Business Insider, and WebMD. Shanon is a passionate leader in nutrition and healthcare. As a registered dietitian and life coach, she is an expert consultant and is sought to guide national businesses and organizations in creating employee wellness programs that focus on nutrition and the human diet. She blends scientific research, nutrition, behavioral science, and social science to promote health, prevent disease, and shape the dietary choices of healthy and sick people. She has been frequently referenced and quoted for providing affirming information to educate consumers on real paths to holistic health. As a board-certified registered dietitian, certified nutritionist, holistic health practitioner, and certified diabetes prevention program coach, Shanon stays at the forefront of health research. Shanon is also a proud member of Dietitians in Integrative and Functional Medicine. Shanon, thank you so much for joining us today. I know as a working mom with two busy teenagers, sometimes making those right nutritional choices can be very difficult. So really look forward to you presenting and helping us with some tips and tricks. So Shanon, I'd like to pass it over to you.
Awesome. Hi, everyone, and thank you so much for the beautiful introduction. I'm so excited to get started and dive right in to this session with all of you, talking about nutrition for wellness. Hopefully you have a pen and paper handy with you because I'm going to be going through quite a bit of helpful tips and tricks that you can honestly take away today and start implementing right now. So a little bit about me. I am the founder and registered dietitian at the Nourish Center. Some fun facts here are listed: born and raised in Brooklyn, New York, and also my practice is in Brooklyn as well. However, I see my patients all across the United States. I also have virtual consultations with my patients. So yeah, just love what I do. Love talking about food. I believe that since we all eat, if I can teach people how to eat in a way that nourishes their body, then my day is made. Next slide, please. So a little bit about the Nourish Center. We specialize in metabolic health through a holistic approach. So what that means in a nutshell is I'm helping patients with conditions like prediabetes, diabetes, hypertension, high cholesterol, overweight and obesity, and through a holistic approach. So I'm not just looking at what you eat or what you're not eating. I want to understand how your physical activity, sleep, stress levels, lifestyle habits, routine, work schedule, how do all of these things play a role in how you are able to take care of yourself. So my specialty, I like to say my specialty is metabolic health, and then my approach is integrative and functional nutrition or holistic medicine. And I have quite a bit of offerings. So from one-on-one sessions to group programs, I often partner with corporate wellness initiatives and offer anything from curated programs that include classes that I spearhead, or sometimes I curate an entire program that a company can just rinse and repeat and use throughout the year on their own and have someone else spearhead it. And then one pretty cool thing that my patients receive are exclusive discounts on wellness products from many known brands for as long as they're a patient. So whether it's a vitamin, mineral, protein powder, even any health and wellness product that you would find in a health food store, even skincare products, shampoo, conditioners that are all natural. My patients get discounts on those from those brands, which is pretty cool as well. So I'm always looking for ways to just make access to nutrition care accessible and affordable. Next slide. So for today's agenda, I'm going to be covering 4 main things. The DREAM framework that I use at the Nourish Center, which is an acronym. We'll get into what it stands for. A Nourish diet, pillars of a Nourish diet, and then ways that you can get in touch with me if you're looking to work together. So DREAM is actually it's an acronym that we use at the Nourish Center, and I'll get into what it means shortly, but we understand at the Nourish Center that health is more than a destination. It's truly a dream you build with daily choices, and it's an ongoing journey. And as such, we practice 4 main things, which are our 4 core values. So 1, holistic education, which I kind of already went over. So basically, we empower individuals with knowledge that integrates the body, mind, and spirit, fostering lifelong well-being. So we focus on the why and the how to get to the root of your health concerns instead of just telling you what to do. And then in terms of sustainable stewardship, we are committed to caring for ourselves, others, and the world with responsibility and intention, ensuring lasting health that is sustainable. So taking care of yourself, but in a way that you can actually maintain long term. Then 3rd is individualized care. So each person is unique, and we honor that with personalized approaches based on each individual's situation, goals, and even personality. So there's no one size fits all solution at the Nourish Center. And then finally, we practice what we like to call empathetic gradualism. So we set clear expectations, put patients first, and practice with empathy and kindness. So we embrace progress, recognizing that meaningful change happens step by step with patience, understanding, and support. So the DREAM acronym that I talked about before, which is our approach, but then also a framework all in one, stands for diet, rest, exercise, alignment, and mindset. So while we all have a dream to improve our health or maintain good health, we help you to bring this to life through these 5 pillars. Your diet, which I'll get into what that exactly means, rest, physical activity or exercise, or some people say movement, alignment. So this taps into both spiritual health, purpose, lifestyle, and then finally mindset, which also, of course, goes into stress reduction, mindset, how you see yourself, and how you live and approach your daily habits and goals. So now we're going to get into a Nourish diet, which is the first pillar of the DREAM framework. So for many, the word diet, which I'm going to talk a little bit about this at the end because we actually updated this to intake, but for this presentation, we'll stick to the word diet for now. But for many, the word diet, let's be real, carries a negative connotation, right? Often linked to restriction or temporary plans or rigid rules. But at its core, a diet simply refers to the way we nourish our bodies daily. It's not about deprivation or perfection, but about fueling yourself with intention. A well-balanced diet reflects your health needs, your personal goals, your culture, your lifestyle. And when approached holistically, it becomes a source of energy, vitality, and satisfaction rather than stress or guilt. So instead of viewing diet at the Nourish Center as something to fix or follow, we define it as a person's dynamic or flexible approach to eating that also adapts to their evolving needs. For example, a male athlete who comes to us may need a high protein, high calorie diet to fuel muscle growth and endurance. Or a pregnant woman might follow a pregnancy safe diet, ensuring enough folate and iron while avoiding raw seafood and unpasteurized dairy for safety for the baby. Or even better, someone with chronic kidney disease may require a low sodium or low potassium diet to protect kidney function and prevent complications. And even others may follow a vegan diet for ethical reasons or a kosher diet due to religious beliefs. So understanding these distinctions highlight that a diet is not one size fits all. And we recognize that nutritional needs evolve also based on life stage, health condition, and personal goals. So that's why we focus on both the art and the science of nutrition at the Nourish Center. And we encourage you to fuel your body with nutrient-dense foods while also leaving room for enjoyment, balance, and sustainability. So today we're just focusing on, again, the D in our DREAM framework, which stands for diet, which I just explained. And it goes into some sub pillars, like what makes up a nourished diet. So we're going to go over the first one, which taps into honoring your needs. So after being this field for such a long time and doing ample amount of research, we realized that it's really easy to kind of check a lot of boxes when you follow this framework, which we called the FPF method when it comes to eating. And this is something that regardless of what your diet may be, you can actually follow. So I'm going to get into that now. FPF stands for, as you can tell here, we love acronyms. We just like to keep things simple for patients. So sometimes we use acronyms or mnemonics to do so. So FPF, when you're eating, you want to look for FPF, fiber-rich carbs, protein, and fats. If you don't remember anything else from today's session, remember FPF. The reason why you want fiber, protein, and fats at every meal is because, one, your body cannot make fiber. And fiber is important to help digest food, give you energy. It helps to balance blood sugar levels. It has been shown to help to balance cholesterol or reduce the bad LDL cholesterol and increase the good HDL cholesterol. And more importantly, fiber is important for our digestive gut health as well. And again, your body can't make it, so you have to look for it on your plate. And fiber can come from a variety of different foods, which we'll talk about in the next slide. You also need protein because guess what? We have 13 different types of proteins, which we call essential amino acids that your body can't make or can't make enough of. So you also want to check on your plate if you have protein there, which is important for building lean muscle mass. This is also especially important for women going through menopause to help boost their metabolism. And also protein helps to tell your brain that you are full hormonally, which is pretty cool. And then finally, you want to ensure that there are some sorts of fat on your plate, healthy fats in particular. And guess what? Your body cannot make all the fats that it needs either. So, you know, those omega-3 fatty acids that we love to talk about, that's in fatty fish like salmon, or even chia seeds or flax seeds, or in fish oil. Yep, that omega-3, your body cannot make. It's also essential. So you should check for fats on your plate as well. And fats actually help absorb vitamins and keep you full in between meals. So if you realize that you're eating and then you're getting hungry maybe an hour after, check if on your plate if you had some source of healthy fat, because that should be providing helping you to be satisfied in between your meals. So adding FPF, fiber, protein, healthy fats, or more specifically, fiber-rich carbs, protein, and fats to your meals can help you reduce cravings, keep you full, boost your energy levels, even absorb vitamins like vitamin D, especially if you're deficient. Vitamin D is a fat-soluble vitamin, so if you're deficient in taking a supplement or eating high vitamin D foods, be sure to eat that with something that has fats in it. Little tidbit there. But eating FPF allows you to focus more on your daily needs and less on food. Next slide, please. And this slide, we're just going to go over it quickly, but as you can imagine, being in this field, we get lots of questions, so we try to answer them all. Many patients ask us, how do I know if something's a fiber, rich carb, or fiber, protein, or fat? So in food science, we just classify food based on the macronutrient, fiber, protein, fat, that it has most of. So technically, botanically, because avocados have a seed, it's a fruit. Anything with a seed in it is classified as a fruit. But because it's mostly made up of healthy fats, we call it a fat, or I like to call it a fatty fruit. So great source of fat right there. If your meal is lacking in fats, add some avocado. But we basically classify food based on the macro it has most of, even though we understand that everything in nature pretty much has a little bit of everything, a little bit of protein, a little bit of fat, and a little bit of carbs in it if it grew from the earth. And as such, so sorry that this is a little bit blurry, but we've also have gotten questions in terms of, okay, Shanon, I have fiber, protein, and fats on my plate, but what about the portions? What does that look like? So we always like to kind of split up the fiber-rich carbs in particular into two groups. One group is on the left side, it's in green, non-starchy vegetables, which typically are lower in natural sugars. And then the orange section, which is your starches and fruits, which are typically higher in natural sugars. So we account for that and make the portion a little bit smaller. This portion plate integrates and overlaps with many other plate methods. So the diabetes plate method also uses a variation of this. There's also the Harvard plate method, the Canada plate method, the choosemyplate.gov method, which also gives variations. But one thing we noticed is that a lot of these methods didn't clarify fats, which is the difference you'll see on this plate. So emphasizing ensuring that your plate has a source of healthy fat for the reasons that I already gave. And this can look like avocado, olives, nuts, or seeds, maybe on a salad, fatty fish, I like to call, like salmon, or tuna, or fatty fruit like avocados or olives, or even healthy oils like avocado oil or olive oil. All of those would be classified as a fat. And the thing is, we do see that oftentimes fats are definitely on the plate somehow, whether it's mixed into one thing or another, but nonetheless, still good to highlight not only having it on your plate, but as you can see, the fats are the smallest portion. So not too much, which I'll get into in the next slide. So next slide, please. So for all my math nerds or mathematicians, please excuse this being blurry as well, and happy to provide the slides at the end. But the reason why we give these portions of foods is because fats are very nutrient and calorie dense. So gram for gram, 1 gram of fat will give you 9 calories, whereas 1 gram of fiber-rich carbs typically gives you 4, and 1 gram of protein typically gives you 4 as well. So you just want to keep a little bit of small portion of fat on your plate, not too much since it's dense in nutrients and dense in calories, and then portion everything else accordingly. So this is further explains why you typically find a plate method that's portioned like this. So in the beginning of chatting with all of you, I explained that this method can work for all different types of cultures, backgrounds, people. And as you can see, here are some examples. So whether you're doing like an African plate, which is in the center with some jollof rice, with some greens on the side, it works. Whether you do maybe like a Mexican food on the upper left corner with some rice and beans, some chicken and a salad, it works. Maybe you're doing Italian food, which is the small bowl there with some pasta and chicken with a bed of green vegetables, still works. So this method is versatile. It can help many different people with many different conditions and backgrounds reach their goals. And we do take it a step further when our patients come to work on specific conditions. So sometimes when I have a patient who may be trying to build lean muscle mass, I might allocate a little bit more than quarter of their plate from protein to aid in getting enough protein to fuel their workout. So it's very customizable, again, more like a guideline or a framework, not a rule, but it's something that whether you're trying to eat more balanced and check all the boxes of what a balanced meal should look like, this is something that you can implement. Now we're just going to skim through the final portions of the nourished diet, or creating your personalized diet. So the second part is honoring your needs with hydration. Now, I understand that a lot of times when people are thinking about hydrating themselves, they just think water. However, I always emphasize that hydration comes in many forms, whether it's herbal teas like ginger tea, hibiscus tea, lemon tea, golden milk latte that you make with a milk of choice with turmeric and herbs and spices. Coconut water, also great, has potassium in there to help with hydration as well. Low sugar electrolyte drinks, even sparkling water counts here. There's a lot of brands I enjoy, like Poppy, Olipop. There's also another brand called Zevia that uses stevia to sweeten their water, which tastes really great. And also water-based freshly pressed juices and smoothies. By water-based, I mean you make the juice or the smoothie with water or coconut water, and then you add hydrating fruits and vegetables like cucumbers, kiwis, lemon, lime, ginger to it, so that you're keeping the natural sugar intake on the lower side, but you're still hydrating your body. So that's very important as well in terms of honoring your needs. Second is also personalizing your needs. So I kind of hinted to this in the beginning as well, but personalization is key to making sustainable changes. So considering things like your lifestyle and activity levels to adjust the portions of the FPF plate I talked about. Also understanding your food preferences and cultural background. For example, my family, everyone is born in Jamaica except for me. I was born here. I'm like, why you guys couldn't have me in the islands? But I digress. But for cultural foods, for example, my family, we like to eat like curry chicken and rice and callaloo, which is similar to collard greens. So you can implement the same method: curry chicken, quarter plate, rice up for brown rice, and the callaloo, the greens, half plate. So understanding your cultural backgrounds and that you don't have to eliminate the foods you grew up eating, just understanding how the portions fit. And then finally, health conditions and goals. So choosing different types of foods and even nutraceuticals too, which I'll lightly get into, that can help to support your goals and needs. I did touch on a little bit or mention nutraceuticals. So the second part of the Nourish diet is also boosting your nutrition. So while this is less important after the implementing the FPF approach or method, this can definitely support the FPF plate. So ensuring that when you're plating your food, that the options there are colorful and that they're whole foods. Adding pre or probiotics to your meals. This could look like yogurt, kimchi, sauerkraut, kombucha, all great gut healthy foods, and even functional foods. So we've seen in research that certain foods have certain compounds in it that can support overall health and well-being. So these are little ways that you can kind of boost your FPF plate to take it to the next level. And next, it's all about practicing moderation. So of course, you want to ensure that you're honoring your needs. You want to boost nutrition, find those things that can help to take your health to the next level. But we can't ignore the fact that there are things that we should moderate, from caffeine and its impact on high blood pressure, likewise for alcohol, to added sugars and its impact on prediabetes and diabetes, sodium and its impact on high blood pressure as well. Saturated fat, we've seen that can increase someone's risk of raising their LDL cholesterol. And then of course, ultra processed foods, which we like to say can sometimes be a triple threat because it can contain all or a mix of sugars and sodium and saturated fat. So practicing moderation is key. However, we intentionally focus on honoring your nutrition first, boosting your nutrition second, and third, practicing moderation, because we have learned that too often people focus first on practicing moderation and taking out this and taking out that when they're trying to eat healthy, instead of nourishing their body with the things that they need, which will inevitably make it easier to eat less of the things that they're trying to limit. So we prioritize our approach in that way. And then second to last is planning for ease. So it's just staying prepared, cutting grocery costs. There's a lot of hacks and things that you can do there to keep healthy eating affordable, minimizing food waste. So the way that you're storing the foods that you buy when you go grocery shopping, certain things, for example, avocado and apples should not be stored together because it releases compounds that make the avocado ripen quickly. Or also certain things should be stored in a dark, cool environment like potatoes or garlic. So storing foods properly so that it lasts longer, it tastes great, and also you're minimizing food waste. Another hack is tomatoes. Whenever I buy tomatoes, never put it in the refrigerator. Always put it out on the counter first, let it ripen, let it continue to naturally sweeten. And then about, when you're noticing, okay, in a couple days, this might start getting bad, then you put it in the refrigerator to slow down the ripening process. If you do that, I promise you, your tomatoes will taste delicious and sweeter. So there's just little things that you can do to minimize food waste. Plan also for eating out. That's another one. So whether you're traveling for work, sometimes I tell I have a lot of nurses as well. I have a lot of lawyers who travel for work. It's important to kind of plan ahead for that. Look at the area, what restaurants or food options you have around you, maybe booking a hotel in areas that are more conducive to healthier choices. And finally, most importantly, probably, is eating with intention. So even if you don't start with the FPF method or boosting your nutrition or practicing moderation, this is something you can do at your next meal. I know we're about at lunchtime now, but eating with intention. So paying attention to your meal timing, your spacing, how frequently you're eating, and meal mindfulness. Each one of these are distinct and different. Meal timing, typically we see that eating every 4 to 5 hours is a good rule of thumb because that's about when our stomach will digest food and we'll start feeling hungry. Meal spacing, how long are you going in between meals, especially from dinner to breakfast the next day? Some people look into intermittent fasting or practice intermittent fasting in terms of meal spacing. Meal frequency, how often throughout the day are you putting something in your mouth, whether it's a meal or a snack? That can impact your blood sugar. And then meal mindfulness, are you slowing down? Are you eating intentionally? Or are you eating on the go, in the car, on the train, what have you? So eating with intention is also something that we try to emphasize here at the Nourish Center. And last but not least, one little thing or activity that you can take away from this is just pick one word that describes how you want to feel this year or today. And focusing on that will make a world of a difference and bring eating with intention to each day. So maybe you want to feel satisfied or relaxed or mindful, just picking a word, and that really helps to put eating with intention into practice. So that's all I have for you. I hope this was very helpful. You can feel free to scan the QR code on the screen. You also get the updated guide. So after wonderful feedback from our patients, though we explained what the diet is, we actually updated this framework to a different name that's called PRIME instead of DREAM, which stands for purpose, rest, intake instead of diet, mindset, and exercise. So when you scan this QR code, you'll get the updated guide as well. But I hope this session was helpful and you found something that you could take away and apply.
Yeah, thank you so much, Shannon. I can tell you, I learned a few new things. I don't know why I've been putting tomatoes in the refrigerator immediately, but I guess maybe I need to, call you before my next grocery trip. So thank you so much for joining us. We really appreciate you giving us some insight on nutrition and wellness. So really appreciate you being here. Thank you. Thank you. I will turn it over next to Denise. We're going to be talking about the importance of sleep, which is one of my favorite things. So thank you again, Shannon.
You're
Thanks,
welcome.
Shannon.